Hi, good morning. I'm Dr. Japheth with NUHS at home. I'm a resident physician. Follow me today as I see my first patient. Okay, so usually we see our caseloads first thing in the morning. We would know how many home visits we have to do. And then that's when we try to divide among the different MOs, who we see. And it also depends on the patient's acuity, whether we need to see them earlier or we can wait until the latter patients that we see. Okay, so usually when I visit a patient's home, number one, I assess them, assess how they are, do a physical exam, do a history taking again, basically follow up on what was done the day previously. And then other things that we do when we do home visits is we can give some IV medications also. Some patients we need to remove some dressings. Some patients we may also need to remove their PICC lines. Whenever I see a patient, we do assume that they're able to care for themselves. And then we assume that once they go out of hospital, everything is sorted. But unfortunately, the reality is sometimes even if these patients have just been discharged, some of the times they are not taking their home medications properly. That's one thing that I do is I help to review their medications, make sure that they are taking it properly. For some patients, you will notice that some of their home environments is not ideal, but we have to make do and we try to treat them as best as we can. And then in some patients, it helps me understand why they might be better at home rather than in hospital. And in other patients, we see that in the home environment, they have a lot of support. They have caregivers, they have enough helpers. In fact, probably better than the hospital because the caregivers and patients are there 24/7. Usually we inform our patients via a call approximately what time we will be going to their place. And usually patients don't have to prepare anything because everything that we need, we will bring along, or things that they need or medication that they need, it will be couriered to them by our nurses, by our couriers. Yes, so during home visits, things can be very dynamic. Sometimes the patients can be quite sick at home. So then we have to make a lot of decisions on the fly and we have to update quite a few people. Unlike in the hospital where you just update the nurse. Of course, whenever we assess patients, sometimes the plans in the morning may change because of what we see when we do the home visit. So those are some of my home visits that I see on a typical day. I hope you had more insight on what we do and what we are capable of and what types of patients we see at home.